Hey everyone, my name is Glenna Perez, and this is the last part of the Muscular Dystrophy interview series. Let's dive in. Why is muscular dystrophy seen as a mental illness? Muscular dystrophy is a very complex disease that affects the muscles and weakens them over time. There is no cure for this disease. There are only treatments that can help them with the symptoms. There is a ton of research that neurologists are mainly doing to try to find a cure and solutions to this disease. The majority of people that get this disease are transferred by their parents. People with a muscular dystrophy is often very hard to figure out because it can most of the time be seen as not something serious or that it was all made up in the mind. It can be very discriminated against people who have this disease because they are not taken seriously or get the right medical attention. It can cause a lot of chaos between doctors saying that it is normal until they dig deep to figure this out. The person is at a high risk of dying sooner because of all the health problems included. It mainly affects the heart and the lungs. Those are the two biggest factors that patients are dying from. From this knowledge I presented, I've decided to get a neurologist's point of view of what they do in the office and how they work with patients that have this disease. A little brief introduction to my neurologist. His name is Dr. Jonathan Strober. He is a specialist in childhood disorders of the nerves and muscles. He directs child neurology services and the neuromuscular clinic at UCSF Benny Hoff Children's Hospital, which is sponsored by Muscular Dystrophy Association. He has advanced training in electromyography, which is the recording nerve function of the muscles to evaluate patients with suspected neuromuscular disorders. His research investigates new therapies for children with neuromuscular and mitochondrial disorders. Mitochondrial diseases are chronic, long-term, genetic, often inherited disorders that can occur when the mitochondria fail to produce enough energy for the body to function properly. Mitochondrial diseases can be presented at birth, but can also occur at any age, including a study to determine the safety of a dietary supplement called creatine monohydrate. Creatine is a substance found naturally in muscle cells. It helps your muscles produce energy during heavy lifting or high-intensity exercise. He earned his medical degree from the Lewis Katz School of Medicine at Temple University and completed a residency in pediatrics at the Long Island Jewish Medical Center. He completed a fellowship in child neurology at the University of Pennsylvania's Perelman School of Medicine, followed by a fellowship in neuromuscular disorders at Emory University School of Medicine. This interview begins with me asking the neurologist what he does on a typical day, and he told me of his schedule of what he does throughout the week.
Clinic all day Tuesday, all day Thursday. But I switched, but now with COVID, it kind of changed things. So, like now I go in and sometimes I do in-person visits, and then sometimes I do telemedicine in the afternoons. And then on Wednesday is our special, muscle clinic. So I go in for that, and then in the afternoon I sometimes do the electrical tests that help with some of those patients. And then Fridays, pretty much all day home, telemedicine.
Telehealth medicine is done without an in-person visit. It is typically over a phone call or a Zoom call with your doctor. It would be mostly done at home or whenever the doctor has time to, but it would be outside the office.
So it definitely is a variable thing. And then, in between there, I'm, again, trying to catch up on all the other things in between patients, and if there's extra time, I have my research that I need to keep going, and lots of paperwork for that, and meetings with people. Like this, I just got off another meeting with somebody about a research project I'm working on that we need to update. So some of the time is free, and some of the time is just scheduled time.
What are your experiences with other patients who have muscular dystrophy?
So I finished my training learning about nerve and muscle disorders 23 years ago now. Almost 25 years. It's crazy. So I went through training to learn all about the diagnosis and treatment. And so then I have the clinic once a week where we see most of those patients. and that's where I've seen you, and that's where we have our team that helps take care of people, and we're constantly, learning, and like it's very different now. Like all the genetic tests that we can do, we didn't have when I first started. We did more muscle biopsies back then. So I go to conferences where we learn about new things, so I can keep up to date and kind of keep changing my practice and how we do things.
Is there any research on possible cures?
Definitely, yeah. So in the most recent years, gene therapy is kind of the way we've been treating or studying to treat and I guess cure, if possible, people. Like, because if you have a gene that's not working properly, if we can give you that gene and your body can make its own gene that's complete, then it's basically like curing the disease in a sense. There are definitely problems with it. It's not a perfect solution yet, but it's definitely a big step in the right direction.
I believe the last doctor that I saw I think it was this year. Yeah. He told me, or he gave me a medication that I've been really trying to get, but it's really hard to get from the pharmacy. It's called prostaglandin, and he said that helps with what's it called? It helps with the muscles, like so it doesn't hurt as much. But I haven't tried it yet. What is your opinion on that?
Oh, that's a medical question. So prostaglandin is something we use for a condition called myasthenia gravis.
While the doctor was explaining, the call cut out, and the connection was really bad. And then he was able to explain it again. That's why there's like a little pause in between.
Prostaglandin basically blocks the breakdown of something called acetylcholine, which is the chemical that stimulates the muscle after it's released from the nerve. And so the thought in some people with muscle and nerve problems is that if you kind of allow that to stay around longer, it could help increase your muscle strength a little bit. It's not a major powerful drug. It's pretty low risk. It's worked for a couple patients. It's not the most, like I said, it's not the most powerful thing we have, and it may or may not do anything, but it's low risk. And I was wondering who prescribed that. Is it Dr. Fay that you saw, or is it somebody else?
Yeah, Dr. Fay.
Yeah, he's big on prostaglandin.
What is the typical reaction when patients find out that they have muscular dystrophy?
Everyone's different. So, if you're kind of if it's a family history, and, you're getting tested because there's other people in the family, sometimes it's a little bit easier to cope because you're already kind of preparing yourself for the possibility, and then you also know somebody who has it, so it's not kind of a big unknown. But a lot of times when we get that diagnosis, people have an idea of what that is, what it means. And, they think of the worst case scenario, and it's not always the worst case. Sometimes it's, a much milder form. But, the first is a shock and kind of like sometimes a relief in having a diagnosis, but everyone's just so different, right? Some people are just like, oh my gosh, I've been having these problems for so long and nobody can figure it out. Now you just gave me a diagnosis and that makes me happy.
Oh, yeah.
Right? So that's a possibility, but then it's like, well, what does that mean? Like, what is it going to look like for me in the future? And then, of course, a lot of that is a big unknown, and that makes it hard for people, too.
Because now researching it, I have more of an idea than I did before when I first found out.
Mm-hmm.
Especially writing this paper, I got to see a different perspective of, other patients that also have it.
Yeah, I think that this is probably a really good thing for you.
What is the current research that you're currently doing?
So I have a lot of studies going in different diseases in terms of muscular dystrophy. Right now we have 2 studies. One is an antibody against something called connective tissue growth factor. So what happens is when your muscles break down, it builds up the connective tissue in the muscles and blocks you from being able to make more muscle. And so this of this antibody will help break down some of that connective tissue so that you have more space for your muscle. And the other one is a drug that works on very specific genetic mutations to help prevent it from causing, it kind of increases the ability for the gene to be produced.
I also saw that there was this drug that is for the heart. I forgot what the name was. I think it's somewhere in my research, but it was talking about how it gave a negative side effect, and that the FDA was not accepting it because of that, and because not a lot of people were testing. It didn't pass what's it called? They didn't do too many testing over it. I don't know if you know what the name was. I kind of forgot what the name.
There's so many things going on, I couldn't tell you.
Okay, another question that I have that I'm really curious about is my personal diagnosis. I've been wondering, because my mom has been on oxygen since the past year, and I'm wondering if that's gonna happen to me too, the same way that she is, or is it gonna be less of what she's going through?
So there's no way I can predict, unfortunately, any of that. I mean, typically you would expect with the same changes, with the same genetic change, that you would have the same course, but it's not necessarily the case. And also, you're gonna go through this at a different time when medicine is different, and so it may, there may be things that come out that will help you so that it doesn't get to that point. So there's a lot of possibilities out there for things to be different for you.
And this is when I'm 30, mid-30s.
That's when your mom, right? Yeah. So you have a way to go. You have at least 10 plus years, right?
Yeah. I'm about to be 20, so.
Yeah. So within the next decade, I hope we have much better treatments.
I pretty much asked all of my questions.
Great.
I just want to appreciate for taking your time to have this phone call, and for me to get more information on this topic. And I just want to appreciate just everything that you've done from this point and on.
Oh, thank you. Well, we're here for you, so whatever you need, just let us know.
Muscular dystrophy treatments can vary of different ones. Specific problems can be tailored to the needs of the patients. The different ones that are available are respiratory therapy. It can be oxygen that would be helping pump air for those weak lung muscles. Physical therapy to improve muscle strength in everyday activities. Occupational therapy can help patients do basic skills like brush teeth and walking around the house a few times. Speech therapy for those who need strength in their face and neck muscles in the way that they talk. Surgery can be needed for any muscles that cause discomfort in the patient. Drug therapy can be medications that can work for those who need pills for their pain. And gene therapy can be used to correct a certain gene that was in the disease and can help them correct the disease dysfunction, making it almost impossible to cure. And that is the end of my research paper. I hope you guys enjoyed it, and stay tuned for more